Good afternoon, everyone. Thank you for joining us for the webinar, American Indians and Alaska Natives in the Marketplace, ACA 101. My name is Chris O'Grady from the National Indian Child Welfare Association. I'm the research manager, and I'll be facilitating today. And Kristen Bitsui from the Tribal Healthcare Reform Outreach and Education Program Associate from the National Indian Health Board will be presenting today. Thank you so much for joining us. You will be muted for the presentation, but if you have any questions, please submit them in the public chat box, and I can ask them to Kristen while she is presenting. And then at the end, there will be time for questions where you'll be able to unmute yourself. So thank you so much for joining us today, Kristen Bitsui, and the stage is yours.
Thank you very much, Chris. So my name is Krista Bitsui, as Chris had mentioned. I am presenting on behalf of the National Indian Health Board's Tribal Health Reform Resource Center. And I'd like to thank the National Indian Child Welfare Association for having us on this call today to give this presentation on American Indians and Alaska Natives in the Marketplace, ACA 101. So today we'll briefly touch on historical background on the Indian health system and how the Affordable Care Act benefits tribal communities. Then move on into special protections for American Indians and Alaska Natives and CMS programs like Medicaid, the Marketplace, and the Medicare. And then we'll be going over, special enrollment periods and the ability to switch plans monthly, and also cost sharing reductions and zero cost sharing and limited cost sharing at any plan level depending on income, and then the ability to apply for an exemption from the individual shared responsibility payment, and also ability to continue to get services from your Indian Health Service, tribal or urban Indian healthcare provider, even after they have enrolled in a private insurance through the Marketplace. So when discussing the special protections in the Marketplace, it's always important to remember that the American Indian and Alaska Natives can continue to receive health care services from the Indian Health Service, tribe, or urban Indian organization, even if they purchase a health care through the Marketplace. So let's start with a list of acronyms that will be used throughout this webinar. So the definitions are listed as you can so you can become familiar with them, and they can be used often throughout the slides. So for instance, ACA, the AIAN is the American Indian Alaska Native. FPL is another one that we use quite frequently, which is the federal poverty level. And then IHCIA, which is the Indian Healthcare Improvement Act. And ITU is another one that we do utilize, which is the Indian Health Service Tribal and Urban Indian Organization Programs or providers. And then CHIP, of course, Children's Health Insurance Program, BIA, which is the Bureau of Indian Affairs, and then QHP is the Qualified Health Plan, and then APTC, Advanced Premium Tax Credits. So here, there is a special government-to-government relationship between the federal government and the federal recognized tribes based on the U.S. treaties, laws, Supreme Court cases, executive orders, and the U.S. Constitution. Because of this special relationship between the federal government and the tribes, the Marketplace, Medicaid, and Medicare contain special protections for Indians. So for this slide, the federally recognized tribes in the AIAN population in the U.S., there are 567 federally recognized tribes in the U.S. Although tribes are located in 34 states, American Indians and Alaska Natives reside in every state. You may see a full list of the federally recognized tribes by visiting the Bureau of Indian Affairs, Tribal Directory, and a list of the Alaska Native Corporation available from the Alaska Department of Resources. A large portion of the American Indian and Alaska Native consumers access health care through the providers in the Indian health care system, which includes the Indian Health Service, tribes and tribal organizations and urban Indian organizations, often referred to as ITUs. There are currently 45 Indian hospitals and over 600 Indian health centers, including urban programs. A large portion of these facilities are managed by tribes. ITUs provide direct care in Indian hospitals and clinics. However, when individuals need health services that cannot be provided in these facilities, they may be eligible to receive a program to purchase care from public and private providers outside the Indian healthcare system, which is known as a purchase referred care. However, the eligibility requirements for purchase referred care are more strict, and not everyone who is eligible for direct services at an ITU facility qualifies for purchase referred care. In addition to IHS, which is Indian Health Service, healthcare in Indian country is provided by various federal agencies, such as supplemental funding provided by the Health Resource Services Administration, or HRSA, or grants from the Substance Abuse and Mental Health Service Administration, or SAMHSA. By enrolling in these programs, American Indians and Alaska Natives benefit by having greater access to services that may not be provided by local ITUs, and the tribal communities benefit through increased resources to ITUs. And the tribal communities benefit, resources to ITUs, but today they're only going to be talking about the CMS programs, and it's important to remember that the American Indians and Alaskan Natives who enroll in the CMS programs can continue to receive care from the Indian health providers. So the Center of Medicare and Medicaid Services administers several programs that impact Indian health. Medicare and Medicaid were signed into the law in 1965. Medicare is a federally health insurance program for people who are 65 or older. Medicare also covers some younger people with disabilities and people with end-stage renal disease. The different parts of Medicare help cover services. Part A covers hospital insurance, such as inpatient hospital stays. Part B covers medical insurance, including outpatient medical care. Part C covers Medicare Advantage plans, which are private health insurance offered through contracts that cover both Part A, B, and often prescriptions. And Part D covers prescription drugs. So if you visit the Medicare.gov and for more information on how and when to change plans. Well, the Medicaid program was created in 1965. The Children's Health Insurance Program was signed into law in 1997. Both are joint state-federal health programs that help the medical costs for certain low-income children and adults. Medicaid eligibility is different depending on whether the state had chosen to expand its Medicaid program. We'll go into more details about this, who are eligible for Medicaid, in a few slides later. So the marketplace is designed to expand access to affordable health care by creating a place where consumers can compare health options. By enrolling in a CMS program, American Indian and Alaska Natives benefit by having greater access to services that may not be provided by the local ITUs, and the tribal communities benefit through increased resources to ITUs. The Affordable Care Act and the permanent reauthorization of the Indian Health Care Improvement Act make special improvements for the health of those in Indian country by expanding and creating programs not just in the marketplace, but within the Indian health system, such as loan repayment and recruitment programs for health professionals. Healthcare services for American Indians and Alaska Natives is a key component of the federal government's trust responsibility. Updating and permanently reauthorizing the Indian Health Care Improvement Act helps fulfill its responsibility. The law also offers American Indian and Alaska Natives more options for health insurance, while they can continue to receive health care through the Indian health care providers. So now we're going to go over a few terms that may be important as we discuss the CMS programs and the Indian protections. First, it's important to understand the definition of American Indian and Alaska Native is different for purposes of the U.S. Census. Eligibility for Indian health services, special benefits and protections under Medicaid and CHIP, and for the marketplace. So in the marketplace, the definition of American Indian and Alaska Native only includes members of the federally recognized tribe or the Inspire Corporation shareholders. But the definition of the American Indian and Alaska Native in the Medicaid and CHIP programs include members as well as persons of Indian descent. This definition is consistent with the IHS criteria for eligibility to receive health services. Although there's a big focus on the health insurance marketplace, it's important to remember the special protections in Medicaid and CHIP that also help increase access to health care for American Indians and Alaska Natives. The Affordable Care Act also created Medicaid expansion, which not all states have elected to do. But if your state has not expanded Medicaid, the protections created in the American Recovery and Reinvestment Act, or ARRA, still apply. And these protections include, one, most Indian income won't be counted when determining eligibility based on income for Medicaid and CHIP programs. 2, no cost sharing for any service under Medicaid for individuals who have used ITUs. 3, protections of money and property derived from Indian resources from recovery by the estate of individuals who receive Medicaid long-term services. 4, American Indian and Alaska Native enrolled in managed care in Medicaid or CHIP can go to an Indian health provider even if the provider is not in the network, and the provider must be paid the customary rate of those services. 5, states must seek advice from ITUs before submitting changes to their program that may have an impact on Indians or Indian health programs, and states must consult with the federally recognized tribe before submitting Medicaid and CHIP waiver requests. So here are some additional benefits from Indians and Indian health providers. States are reimbursed 100% for Medicaid services provided through IHS and Tribal 638 facilities, and do not have to pay a share of the cost of care like they do for other individuals. There is no cost sharing allowed for American Indian and Alaska Natives and CHIP. This is a very important one, so keep in mind there is no cost sharing when it comes to American Indians and Alaska Natives when they do benefit from the CHIP program. And the Indian health facilities are not subject to local licensure by the state, but must meet licensing standards, and health professionals must be licensed and in good standings in at least one state. For purposes of the marketplace, an American Indian and Alaska Native is limited to members of a federally recognized tribe. There are several protections in the marketplace. So there's the special enrollment period and the ability to switch plans monthly, and then cost sharing reduction in the zero cost sharing and limited cost sharing at any level plan depending upon income, and an ability to apply for an exemption from the individual shared responsibility payment. All qualified health plans will cover these 10 essential health benefits. So you'll see that some of these benefits are those that are not available at every clinic, particularly behavioral health and pediatric oral and vision care. Even though plans must cover the same set of minimal essential health benefits, the value of these benefits will vary across 4 metallic levels: the bronze, the silver, the gold, and the platinum. This means that the amount of cost sharing required will differ in those tiers. For example, bronze plan will have the least generous coverage with more out-of-pocket costs for enrollees, and platinum plans will have the most generous benefits. However, these plans might be the best choice for federally recognized tribal members because they do not have any cost sharing for essential health benefits and may qualify for those premium tax credits as mentioned earlier. What this really means is that you should use the tools provided in your marketplace to explore the options and make sure that your local clinic or provider is part of the network. After you apply using the Streamlined application, you'll be directed to either your state's Medicaid or CHIP program or the health insurance marketplace depending on your income and other information you included on your application. So first, we'll just go ahead and talk about the Medicaid and CHIP. It's important to understand the Medicaid and CHIP program and its protections for American Indians and Alaska Natives. If you don't qualify for Medicaid or CHIP, you may qualify for health insurance on the marketplace. You will be asked to report your household income on the application. This will help determine which CMS program you are eligible for. You'll see 100% FPL or 400% FPL in different places throughout this presentation, outreach material. These numbers are based on the national federal poverty level as determined annually by the federal government. Eligibility for many programs are based on percentage of federal poverty level and where your income falls on the scale. In order to be eligible for cost sharing reduction and monthly special enrollment period, American Indians and Alaska Natives must demonstrate membership in a federally recognized tribe or Alaska Native corporation. On the online application, there is a drop-down list of federally recognized Indian tribes and Alaska Native corporations. At this time, there are no approved electronic data sources in the marketplace to support tribal verification. The marketplace accepts documentation by the federally recognized tribe or Alaska Native shareholder status, demonstrating membership or shareholder status. After your application is verified, your eligibility is determined. If you are eligible for Medicaid or CHIP, you'll be directed to your state's Medicaid program. So after you apply through the Streamlined application, you'll be directed to either your state Medicaid or CHIP program or the health insurance marketplace, depending on your income and other information that you include into the application. So let's talk about Medicaid and CHIP. It's important to understand that Medicaid and CHIP program and its protections for American Indians and Alaska Natives. If you don't qualify for Medicaid or CHIP, then you might be able to qualify for the marketplace. So every state is required to cover certain groups of people. These are considered the mandatory categorical needy groups that are required by statute and include children and families, pregnant women, and disabled and aged people. States must provide the full range of Medicaid services to elderly, disabled, and pregnant women and children covered by early periodic screening, diagnostic, and treatment. States may also determine additional benefits and additional groups, including the new Medicaid expansion group. Okay, so in this slide, it looks like it did not go through. So there are, let's see here. Oops. Okay, so in this slide, the Affordable Care Act expanded Medicaid programs includes childless adults, but the United States Supreme Court decision allows states to choose whether to expand their Medicaid programs. So this slide shows all the different categories included in the Medicaid expansion. Parents of children covered by Medicaid and CHIP, parents of children who have grown and left home, women that states currently cover only while they are pregnant, older people still too young for Medicare, younger people just started out on their own, and individuals who are not yet in poor enough health to qualify based on disability. So in this slide, this is a map of the 32 states that expanded Medicaid, but you should also check with the state Medicaid program to ensure that the services provided under the Medicaid expansion are covered under your level of care that you need. These special protections are often referred to as ARA protections because they are as a result of the American Recovery and Reinvestment Act of 2009. We often discuss these protections when we talk about Affordable Care Act because if we don't qualify for health insurance on the marketplace, you may be eligible for Medicaid coverage even though the protections are part of the ACA. So for instance, Indians enroll in Medicaid or CHIP do not have to pay premiums or enrollment fees. This is extremely important for those that do work with American Indians and Alaska Natives. If they qualify for Medicaid or CHIP, Indians enrolled do not have to pay premiums or enrollment fees. And second, if they receive care from an Indian healthcare provider or through a referral to a non-Indian provider, they do not have to pay any cost sharing, such as deductibles, co-insurance, or co-pays. And finally, certain types of Indian income and resources are not counted when determining Medicaid or CHIP eligibility, which are listed here. The per capita payments from a tribe that comes from natural resources, payments from natural resources such as farming, ranching, fishing, lease, so including those that are on the reservation and former reservations. And then this is also a big one, money from selling things that they have, for instance, like pottery, rugs, jewelry that they make, beadwork. So any money that they get from that is not counted when it comes to Medicaid and CHIP. So if you don't qualify for Medicaid or CHIP, they may be eligible to purchase a qualified health plan on the marketplace, and the Affordable Care Act provides American Indians and Alaska Natives with special protections in the marketplace. So we've been referencing the special protections for American Indians and Alaska Natives in the marketplace. Let's take a closer look at each special protection, starting with special enrollment periods, or as they call it, SEPs. American Indians and Alaska Natives qualify for SEPs, which means they're eligible to change health plans once a month and not limited to changing plans during open enrollment like other consumers. So make sure to check with your state website for more information about how they process SEPs for American Indians and Alaska Natives. So even though American Indians and Alaska Natives can change plan once a month anytime during the year, they still should be aware of the potential coverage gap that can happen when switching plans. This is best illustrated by going through an example. If you change plans, let's say on May 15th, your current plan will continue through May 31st, and your new coverage will begin June 1st, meaning you won't have any day in the month without coverage, also known as a coverage gap. However, if you change plans on May 16th, your coverage plan will expire on May 31st, but your new coverage might not take effect until July 1st, resulting in a 30-day coverage gap. Either way, the best way to avoid a coverage gap is to consult with your current plan and the plan that you want to enroll in about the best process for changing plans to avoid coverage gaps. Also, the other thing you need to remember is that American Indians and Alaska Natives can enroll and change monthly plans throughout the year, but please keep in mind that December 15th is the cutoff to make changes or enroll in a plan that will be effective January 1st. Benefits and premiums are subject to change. You don't want to be surprised, so you want to encourage consumers to come by December 15th to review and make adjustments in their health coverages. So most American Indians and Alaska Natives think that, oh, well, I can change any time throughout the year, but they don't realize that there are new plans that come out for 2017. So the current plan they are on may have increased, and they won't know until that bill comes in. So we are encouraging that December 15th deadline. So the next special protection is cost-sharing reduction, which includes copays, coinsurance, deductibles, and other similar charges. These special rules apply to American Indians and Alaska Natives enrolled in qualified health plans receiving essential health benefits and are based on income. There are two types of plan variations that provide cost-sharing reductions for American Indians and Alaska Natives: zero cost sharing and the limited cost sharing. For the American Indians with incomes between 100% to 300% of the federal poverty level can enroll in a zero cost sharing plan, which means no copays, deductibles, or co-insurance when receiving care from the Indian health care provider or when receiving essential health benefits through a qualified health plan. In addition, there is no need for a referral from an ITU provider when receiving essential health benefits through the qualified health plan. So American Indians and Alaska Natives with income below 100% and above 300% of the federal poverty level can enroll in a limited cost-sharing plan, which means no copays, deductibles, and coinsurance when receiving care from an Indian health care provider and receiving essential health benefits through the QHP. And they will need a referral from an ITU provider to avoid cost sharing when receiving essential health benefits through the qualified health plan. Certain income limits are between 100% federal poverty level and a 400% federal poverty level. If your income is below 100% of the federal poverty level, you do not qualify for advanced premium tax credit. American Indians and Alaska Natives with income below 100% of the FPL qualify for cost-sharing reduction. If you qualify for the APTCs, your premiums could be very low. It is also possible for your tribe to pay for your premium through a tribal premium sponsorship program. Please contact your tribe to see if they are participating in this program. So here are some insurance lingo that can be tricky at times, but it's not impossible to become familiar with the basics. The next two slides list basic health insurance terms and their definitions. So let's look over the 8 basic insurance terms that may be used in today's discussion. And when you're dealing with the American Indian and Alaska Natives, there are some that don't have any idea of what any of these terms mean. So it's always good to have this on handy so that they will be able, so you can translate to them and let them know what each of these terms mean. And, they're pretty basic, the benefit, co-insurance, co-pays, even the pre-existing conditions, and, premiums, deductibles. Those are things that they don't hear all the time, knowing that, most American Indians and Alaska Natives, if they've never had insurance before, or private insurance. And a lot of this is through the Affordable Care Act. So any basic health insurance terminology is always good to have on hand to explain to them. It is also important to review your summary of benefits with them to purchase a plan. Make sure that you're buying the correct policy. There have been errors on plans that are on the marketplace, so always be sure to check before you buy. So when you look on there, especially if you are, eligible to receive the no cost sharing, and you're not supposed to be paying any copays or deductibles or anything like that, it should be on the summary of benefits. So make sure that you review your summary of benefits before you decide on the plan that you're going to be utilizing, or that if you're going to be paying for. So this is extremely important to make sure that you do review that. So Indian exemptions. So American Indians and Alaska Natives and other individuals who are eligible to receive services from an Indian healthcare provider may qualify for an exemption from the shared responsibility payment. So this is something that we get a lot of questions on. If I don't get health insurance and I am doing my income taxes, I want to be exempt. So keep in mind that those that are federally recognized tribes are the ones that will be able to provide, their tribal IDs or anything like that. And those that do receive services from an ITU provider can also obtain a letter from their ITU to stating that they do utilize the services there, so they can be exempt from the shared responsibility payment. So September 18, 2014, Secretary Sylvia Burrell announced that the individuals that are eligible to receive services through an Indian Health Service facility were also available to file for exemptions through the tax filing process. Prior to that announcement, only members of the federally recognized tribes had an option to file an exemption waiver through the marketplace or the tax filing process. So they went ahead and did away with the forms through the marketplace to do the exemption. So now American Indians and Alaska Natives are able to, do it on their tax returns when they're filing. So the paper application for the exemption will no longer be accepted through the marketplace. So the form itself, there are 3 parts of the IRS Form 8965. And so let's take a look at that form. So the form is the IRS Tax Form 8965. And Part 1, if you have an exemption certificate number, they can input it in Part 1. And then Part 2 is eligible for specific income exemption. And then Part 3, if they don't have no exemption certificate number, they can self-attest and claim a specific exemption for this. And the exemption code for American Indians and Alaska Natives is the code E, like an elephant, E. And then here's the instructions for the Form 8965, and you can find this in the IRS. And here's the link that you can go to get the instructions and the form. So in the previous slides, I had reviewed the 10 essential health benefits, and the qualified health plans through the health insurance marketplace are required to offer 10 essential health benefits. Mental health and substance use disorder services, including behavioral health treatment, are one of the 10 essential health benefits. You cannot be denied coverage or charged more by plans on the marketplace for pre-existing mental and substance abuse disorders. Additionally, qualified health plans cannot put yearly or lifetime dollar limits on any essential health benefit, including mental health and substance use disorder services. And lastly, the marketplace also offers a parity protection for mental health and substance use disorder services, which states that limits applied to mental health and substance abuse services cannot be more restrictive than limits applied to medical or surgical services. So for example, co-pays, co-insurance, number of visits. Most plans must cover a set of preventive services for children at no cost, including co-pay or co-insurance, and even if the consumer has not met the yearly deductible. This includes Marketplace and the Medicaid coverage. There is a wide variety of preventive health services that are offered to children. These range from alcohol and drug use assessments to iron supplements or vision screenings. However, there are many more preventive health services for adolescents and children offered through the Marketplace. So you can go through, or you can go to the healthcare.gov, and then they have a list there on all of the preventive care for children. But just remember, for American Indians and Alaska Natives, if they qualify for Medicaid and CHIP side of it, there is no copays or no deductibles at all. So for division, I would like to expand a bit on one of the many preventive services offered through the health insurance marketplace for children. Ensuring their child has healthy sight is important. So it is recommended that children get at least one screening before the age of 6. Typically, doctors will begin with a basic vision screening of your child during the first baby visit, around about 3 or 4. Through the qualified health plans of the marketplace, all of these services are covered. And of course, with the Medicaid and CHIP, it does include the vision for kids. So prior to January 2016, many foster youth were at risk for aging out of their foster care programs and Medicaid services at age 18 and other ages as determined by the state. Thanks to the special Medicaid extension, which mirrors the provision of the ACA that allows young people to stay on their parent plan until age 26. Many foster children are able to keep their Medicaid services beyond their foster care.
Hi, Kristen.
Yes.
Teresa wanted to know if the PowerPoint would be available online after the presentation.
I believe so. I think that, yeah.
Thank you.
Mm-hmm. Okay, so for the dental services, so there are 2 ways through which you can obtain dental service through the health insurance marketplace. To buy a qualified healthcare plan with a dental plan included or to purchase a standalone dental plan, it is important to note that you may only buy dental plans through the marketplace only when you enroll in a health plan at the same time. So under the healthcare law, dental insurance is treated differently for adults and children 18 and under. Dental coverage for children is an essential health benefit. This means that if you're getting health coverage for someone 18 or younger, dental coverage must be available for your child either as part of the health plan or as a standalone plan. And just please note that while dental coverage for children must be available to you, you don't have to pay for it. Dental coverage isn't an essential health benefit for adults. Insurers don't have to offer adult dental coverage. So here are some key points to keep in mind. So the federally recognized tribes and the federal government have a unique relationship. The federal government has a responsibility to provide members of a federally recognized tribe with health care. And also, by enrolling in Medicaid or a marketplace qualified health plan, American Indians and Alaska Natives benefit by having greater access to services that may not be provided by their local ITUs. Using non-tribal health care resources can increase the resources available to others in your tribal community. Eligible American Indians and Alaska Natives have certain protections and exemptions under the Medicaid, CHIP, and Marketplace. So keep in mind, so for Medicaid and CHIP, American Indians and Alaska Natives are exempt from cost sharing, and certain Indian income is excluded in determining eligibility. And in the Marketplace side of it, American Indians and Alaska Natives have special monthly enrollment periods. They could qualify for zero or limited cost sharing, and an ability to apply for an exemption from the individual shared responsibility payments. And lastly, whether an American Indian or an Alaska Native enrolls in Medicaid, CHIP, or the Marketplace, or applies for an exemption, the American Indian and Alaska Native can continue to get services from an ITU at no cost to the individual. So a lot of times, many American Indians and Alaska Natives thought that if they get on some sort of insurance, they would not be able to go to their local Indian health service or tribal facility or an urban health center. But they can still continue to use that, and they don't have to pay anything at any cost. And here are some additional resources that would be available to you, and you can do some more research on it. And CMS always has great materials, and they provide all of the American Indians and Alaska Natives materials. Any kind of outreach that you want to do, you can print them out, or you can request them to mail it to you. So they are a good place to go to get tribal materials for American Indians and Alaska Natives. And then that is it. Any questions at all?
Hi everyone, just wanted to let you know that during the question and answer session, all of the phones will be unmuted, and you can self-mute yourself individually by pressing *1, and we will send out a copy of the PowerPoint presentation afterwards. NICWA will, but it's also available for download as a PDF within the screen, so if you look under Files for download. So does anyone have any questions? So I just wanted to check, does anyone have any questions or comments for Kristen?
Hi, Kristen. This is Puneet Sahota, the Director of Research at NICWA. I was wondering if you could just say a little more about how child welfare staff can assist youth and families in the child welfare system with accessing care under the ACA, or if there's a top 2 or 3 tips you would have for them on working with that special population.
Yes, of course. So for those that are, enrolling or doing an application through the Affordable Care Act, at each of the ITU facilities, which is Indian Health Service or a tribal organization or an urban clinic, they do provide assistance to any of the American Indian and Alaska Native population. And it's always different each time. Each individual is different when they apply. So it's always important to, have the documents, to have it on hand. If they, move from one state to another, also having that document that states that, they did have Medicaid in one state if they're going to another state and applying for Medicaid in the other state. So any kind of documentation is always great to have, and, having that American Indian, Alaska Native tribal enrollment card if they do have it. I do understand that there are some times when, foster kids do lose those documentations, but if they have Medicaid, they're able to gather those documents from that Medicaid office too. So when you do transfer to another state, it's always important to let the individual know, the caseworker that you're working with, and let them know that, the individual did have Medicaid beforehand, and so they can also work with that state.
Thank you. And do all states provide coverage through Medicaid after or up till the age of 26 for children that were in the child welfare system, or is it only states that had the Medicaid expansion?
No, it's actually all states. So there was a bulletin that went out from CMS, and just to inform the states that how to pursue, to help individuals and those that were on Medicaid and that they did age out of their Medicaid, and it's up to I believe under age 26. So that bulletin provided Medicaid coverage, or to let states know that Medicaid coverage to former foster care youth who age out of the foster care under the responsibility of another state or enrolled in Medicaid while in foster care are now applying, for Medicaid in another state. So that bulletin did go out, I believe, the end of November, to notify the Medicaid services in each of the states, especially if they move into another state.
Thank you.
So there are a lot of, special protections and provisions for American Indians and Alaska Natives. You have to really, make sure, because most Medicaid offices, don't work with American Indians and Alaska Natives on a daily basis, and, that's not the majority of the populations that come into their office. So it's always good to, refresh your memory with the ARA program, or the ARA, and to, get yourself familiar with that so that which incomes that American Indians and Alaska Natives don't have to use against them. Because sometimes, even just a few dollars, you might be over for Medicaid and you become ineligible. But if it's something that came from, a beadwork or maybe a rug or pottery that they were using, and we always get asked, how do we know, if American Indian family, is, using that profit, and how do we know that we don't use that income? The best way to differentiate that is, those that have American Indian Alaska Native businesses that do their income taxes, that will be counted. So the income that an individual that just uses it, and, they make a pottery and they sell it that one time, and, it's just something that, they end up using for their daily necessities, then that income will not be counted. So it's always extremely important to know, all these little special protections and provisions when it comes to American Indians and Alaska Natives.
So Kristen, I just have a qualifying question of that. If someone does trapping or fishing on the side, will that be taxed? Do they have to report that as income, or only if they have a trapping or fishing business?
If they have a trapping or fishing business, yes, that's when they would have to count that income. But if it's something that they do on the side and, they don't use that income to report to the income taxes, then that income is not utilized when it comes to Medicaid and CHIP side.
Thank you.
I'm wondering if you have any guidance for all of us or thoughts about how all this may change with the new administration coming in. I was wondering if you're anticipating these same protections to be in place maybe it's too early to ask that, but I just wonder if you or, others at National Indian Health Board have any insight or guidance to share with us on that.
Okay. So as far as we know, this is still the law. So we do have to follow it, and as long as it is still the law, we still are going by all of the special protections and the provisions that come along with it. Nothing hasn't changed at all as of today. So for the next following year. So until we also, we've been asked so many times on, what's going to happen? What are we going to do? Is there going to be changes that are going to be going on? We really do not know at this time, but as far as we know, it is still the law. So we are still doing outreach and education and letting the American Indian and Alaska Native communities that, you can still go on, you can still change on a monthly basis, and, all of the subsidies are still there for this year. So we were getting questions on, well, what if I end up paying for it and here it changes the next following month? So, but for 2017 tax year side of it, that we were told that there will be no changes at all.
Thank you.
Mm-hmm.
Do we have any other questions for Kristen? All right, if we have no other questions for Kristen, I just want to say thank you so much for the National Indian Health Board and Kristen for your time today. It was a great presentation with a lot of information, and just thank you so much, and everyone have a great afternoon.